We've discovered patterns.
The connection was always there.
This changes everything we thought we knew about human health.
Health Revealed. My name is Cory Endrulat. I am joined by Stephanie MoDavis, Scott Gordon, and Leslie Powers. Welcome back to our interview series where we will be sharing with you amazing guests and unique or untold perspectives to shift the current paradigm of health in all the institutions of our world. From the micro to the macro, the individual to the collective, we aspire to connect the mainstream and the alternative, integrating solutions. And we welcome you to participate in this whole project with us, share your story, your resources with us. This is a fully independent project because we care deeply about our world. We believe that true healing and true freedom is indeed possible. And in these interviews, we want to also provide you with practical action steps that you can take in your own life to better your own health. So without further ado, we have an amazing guest today, somebody I've been following for quite a number of years. Dr. Andrew Kaufman, MD, is a public speaker, researcher, and natural health practitioner with extensive credentials in psychiatry and forensic medicine. He holds a Bachelor's of Science in Molecular Biology from MIT and a Doctor of Medicine from the Medical University of South Carolina, with psychiatric training completed at Duke University Medical Center. Dr. Kaufman previously served as Clinical Assistant Professor of Psychiatry at SUNY Upstate Medical University, where he held faculty leadership positions, including Medical Director of Faculty Practice and Assistant Director of the Forensic Psychiatry Fellowship, with board certification in both psychiatry and forensic psychiatry. After years in clinical practice as a forensic psychiatrist and expert witness, Dr. Kaufman transitioned to researching the relationship between body, mind, and spirit, and now focuses his work on spreading truth, promoting individual health autonomy, and educating people on natural approaches to wellness and self-care at the highest level of consciousness. And so all platforms, Dr. Andrew Kaufman, MD, you can find his work there. I'll head it over to Stephanie.
Thanks, Cory, and thank you, Dr. Kaufman, for being here. I admire you for many reasons, but one of the reasons why I admire you so fully is because I've spent 25 years as a patient myself, really indoctrinated in massive institutions, Johns Hopkins, NYU Langone, with facing my own autoimmune illness that led into 2 kidney transplants. So my entire 20s, I really was spent in relationship really fully within the medical system itself. And coming from a yogic background, I realized very quickly how dysfunctional, disconnected, and fragmented not only the model was, but all the patients I was around and even the doctors I was creating really intimate relationships with. So for you to speak out the way that you do in my eyes as a patient, you are somewhat of a hero in my eyes, but I do understand that this transition of you going from being within the system and the comforts of within the system to now being solo and talking about sovereignty and self-responsibility and personal agency, and especially the corruption within the system. My first question to you is, what was it really specifically that catalyzed you where you found the courage to leave your tribe and to go out on your own? I'd like to know if you had a specific catalyst for that. And my other question is, facing the egos within the system as somebody who's gotten out of it, what's your relationship with a tribe that you once were enmeshed with as a part of your calling?
Wow, well, there's definitely a lot to unpack there. And, I was in a process of working my way out of the system, but there was a catalyzing event, and it was COVID, because I was speaking out publicly about various issues, related to the cause of the alleged illness, and also about the tyrannical policies, including the lockdown and such. It was a very strange time because I was considered necessary personnel or whatever. So I was not, part of the lockdown. Not that I would have done it anyway. But when the mask mandate, came down, the place I was working tried to impose it on me, and I would have no part of it. In fact, I really don't think it's possible to interact about psychiatric issues, with a patient between such a barrier like that. There's a lot of sensitive information that gets discussed in that kind of relationship. But that aside, they essentially, terminated my contract once I stood my ground on that issue. And that definitely pushed me to have to, figure out how to do something different to make a living. I didn't want to end up on the streets for sure. And I already had been studying natural healing for a couple of years. Even long before I even heard about natural healing, I already knew that things weren't working because I had clinical experience seeing, when I used to work in cancer medicine when I started my career before psychiatry. And I saw virtually all the patients die, despite any treatment. And I even wondered if we weren't hastening or precipitating their death with some of the treatments. And then in psychiatry, I saw nobody get better in any meaningful way from the drugs. I occasionally saw someone come out of a really extreme episode, but they had another one soon in the future. So at that time, I took it as an opportunity to just move forward and never look back, and really started fresh. And of course, this really alienated the people, my tribe, as you refer to them. I believe of all the people that I had befriended, during my training journey through school and residency, there's a lot of camaraderie that actually develops there because, you're put in there with a cohort of people at the same stage. You might be different ages, but medically speaking, you're at the same stage of development. And then you're put through hazing rituals and such, which enforces the bond, just like people might experience in a fraternity or sorority, or even in a cult group, a secret society. So I had definitely built up a lot of friendships, and then also in my further professional life, my academic colleagues, and I was very involved in a professional organization where I held leadership positions. And, of course, I didn't really get in touch with every single person, but the majority of them pretty much were either really upset with me or thought I had gone off the deep end. And so I don't really have those relationships anymore. And there were, certainly a couple of people I really felt a strong bond with, and that all dissolved. Just like many people experienced during COVID, the polarization was really of a great magnitude. But I essentially developed a new tribe of people that I feel much more aligned with, and my career and path forward is much more satisfying and moral way forward. So I have no regrets about anything that I went through.
Wow, that's incredible. And that transition state between exiting and coming into who you are now, I'm sure wasn't that easy. I feel that that's why a lot of physicians don't do that, is because there's this liminal space between who I was and where I'm going, and they can't afford it on many different levels to do that. Andy,
Well,
go ahead.
Oh, if I could add a little to that, it's even a little bit more than that, because think about the social status you have from being a doctor. In my family, even. Right. I was definitely, whenever there was a gathering with relatives, everyone wanted a piece of me. Oh, we're so proud of you, that kind of thing. And so it's hard because once you realize the truth about it, you can't really continue to practice there. I mean, what am I going to continue to give people poison and kill them? It's kind of a no-brainer if you really look at it honestly. But of course, in order to do that, you realize, oh, I have to give all this up. And then there's risk. Like, am I going to be able to do something else? Am I going to end up cleaning swimming pools or something like that? Am I going to, is my spouse going to leave me? Are my kids going to, no longer be able to go to private school and all of these? So there are a lot of obstacles, and I'm glad I did it, but I realize why it's difficult for many.
Yeah, we are beyond a precipice of a tremendous evolutionary awakening, and people going from this old paradigm to this new paradigm that we're all still creating is definitely messy. After my second transplant, being in the field for 25 years and having experienced being in a wheelchair, 5 years on dialysis, the gamut, I created a nonprofit called Awakening Healthcare to help patients and providers who were going through their own spiritual awakening, which what happened to me in a dialysis chair. And through my own inner transformational work, I realized that I didn't need the meds like they were prescribing them specifically, especially the psychotropic meds. Like, my whole life changed. And coming from that yogic background, that was a big part of it too. When I actually came to Houston, which is the largest medical center conglomerate in the world, pretty much here in the Houston, Texas area. I don't know if you've ever been here, but it's just tremendous.
Well, I mean, I know you've got MD Anderson and Rice and So
Baylor, Houston Methodist, just list goes on and on. And I came here to implement my program for patients, for the transplant community, to help them get some psychospiritual, emotional support. And I spent about 6 months working really, really hard. And all of the patients and all of the providers said how desperately necessary it was. But when it came to implementation in the system, because I was in the hospital, most of the doctors and physicians didn't have the time and couldn't really get on board with this alchemical gold I was trying to bring back to them, because it challenged their own paradigm so much. So sadly, the whole thing failed. And it wasn't because it wasn't needed. It was because I felt that the doctors weren't ready to change their mindset, because what I was offering would have changed their system. So such a bummer, but thank you so much to everything that you do. And about the psychological, psychiatric aspect of it, I'm sure you know, in the organ transplant world, when people are facing their mortality, meds, prescriptions, all sort of psychotropic meds are just prescribed normal like candy. They'll just say, oh, it's normal to be depressed. It's normal to be anxious. Just take all these medications. And I've heard doctors actually say, psychiatrists say, take them. I take them too. Don't worry about it. So just this normalization that you're not going to be able to handle something like this and really develop the resiliency. If you're fortunate enough to make it, we don't have to talk about the organ transplant stuff. I know you talk about that a lot, and I'm really tapped in with that as well. And I'm all on board with the whole thing with the brain death and consciousness. I'm all on board. And I think that's going to be something very important as we proceed. But I want to hand it over to Leslie, who wants to talk more about psychiatric illness and kind of root causes of all of this chronic illness stuff we got going on. So.
Sure. My interest comes through my profession, which is I'm a clinical social worker, and I do individual and group therapy, with individuals. But, majority of patients that I work with are on psychotropic medications. There's a certain belief system about what causes mental illness, and adjusting the serotonin and all of that and dopamine. And I wanted to ask you what conclusions have you come to as the root causes of mental illness, and what are the most needed, root treatments? How do we help people to be more mentally happy and free?
Yeah, well, that's an excellent question, and the answer has absolutely zero to do with any neurotransmitters like serotonin or dopamine or norepinephrine. In fact, most likely those things aren't actually even in our body. And certainly the role of them is really not understood even in the mainstream. And even if it did have some relevance, this was actually a teacher of mine in psychiatry made this analogy. Because, the idea is that in a specific part of your brain, in the limbic system, there are serotonin receptors that you want to augment with these drugs. But of course, you can't inject them into the middle of the brain. So you take them by mouth, they go throughout your whole body. So the analogy that he made was, it would be like, instead of, putting the motor oil in the hole where it's supposed to go, you just pour it over the top of the whole engine compartment and hope that some gets there. So even if you take it at face value, it still doesn't really add up if you simply look at some of the details. But I would say that, one thing is that we have to completely, throw out all of the DSM diagnoses, because there aren't hundreds of discrete, mental illnesses, and those are all just made up categories. Obviously, there is a variety of suffering that we experience, and you experience it as a therapist, and I've experienced it, and I've done a lot of psychotherapy. I know many psychiatrists ignore that and just focus on drugs, but for me, when I chose a residency, it was super important that I get that training, and it was mostly from psychologists, actually, but some psychiatrists as well. But even that is, the way it plays out for most people is not particularly helpful in the real world, unfortunately. But what I see as the three primary drivers of most misery, and let's just put, real mania aside, because I think that's a distinct thing, And let's put psychosis aside, or schizophrenia, more aptly that category of disorders aside, because I think those are distinct. But most of the suffering that we all experience to some degree in our life, and that would be diagnosed with things like depression, anxiety, PTSD, impulse control problems, all of those types of things, personality disorders, as stemming, from trauma. And trauma doesn't have to be, being beaten nearly to death or being raped. It could be much more subtle than that. From existential crises, which is being faced with your own mortality. And that, of course, can play out in a lot of different ways in life. Many people know about the midlife crisis as a stereotypical example, but it's much deeper than that. And addiction. And addiction is intimately related with loneliness or some kind of social isolation or conflict. So I find those three aspects are universally, and of course the specifics are going to vary from every individual, is different, but those seem to be the main drivers of all this kinds of suffering. And of course there are different ways that you could heal from those, and that's how I approach it when I work with people or when I teach about it.
Thank you. And I agree, from my perspective as well. And I am curious though about your thoughts on mania and psychosis as well, because when I've had a patient who was in a full-blown psychosis, not making sense, not able to really string logical sentences together, it was a medication that brought her back to a level of coherent. But there's a common belief that once you are on a antipsychotic, that you have to be on it forever. And I've not seen that to be true. And so it's a bit of a mystery to me what causes that. Is it an overwhelm? I'm just curious what your thoughts.
Let's talk about these two things a little bit separately, because they are distinct things. And so when I say, true mania, that would be normally talked about as bipolar disorder, but it's extremely misunderstood and overdiagnosed and misdiagnosed in almost all cases. Like, for example, if any patient says I have bipolar disorder, they don't actually have it for real. Because the person who really has it would say that they're perfectly normal and there's nothing wrong with them. So what it is it's a very extreme behavioral, let's just call it a behavioral disturbance, where someone for a period of days to weeks to even months continuously doesn't need to sleep. So they're not trying to sleep and unable to. They simply don't need it. They have tons of energy, and for 20, 22, 24 hours a day, they're going. And they're doing productive activities, except what they produce is not very good quality. So they may repaint their house, but do a sloppy job. They may write pages and pages in a journal or a novel, but it won't fully make sense. They may, go on shopping sprees in the middle of the night at Walmart, buy 3 cars when they can't afford one, go to be involved in the sex industry, because they can get very promiscuous during these periods of time. They generally end up in trouble with the law or in a hospital. Because it's such extreme behavior. And you see a spike of this usually in the spring as the daylight increases. I used to see it in various settings in the ERs and the jails, follow this pattern, not exclusively, but the majority of cases. And it seems to be related somehow to circadian rhythms and to the sleep-wake cycles primarily, and I think it's actually a kind of a neurologic thing of some sort. And if you just induce sleep in these folks, they will go back into normal behavior for a period of time. They may have another episode in the future, but anything that you do to make them sleep, like any kind of drug, if you give them anesthesia, if you give them a mood stabilizer, an antipsychotic, it doesn't matter. If they sleep, they'll generally reset back into a normal pattern. What causes it, I'm not really sure. There's, some weak epidemiologic evidence about cured meats, but that may be a red herring. But let's talk about schizophrenia. So this is a little bit more complicated because there's a lot of episodic types of where people can become psychotic briefly. That can happen during a medical illness. It can happen many times from certain types of drugs, especially stimulants, things like amphetamines. Sometimes people who, use those drugs actually become chronically psychotic, and it's sort of hard to tell if did the drug make them more vulnerable? Did they go to drugs to escape what was happening, internally? But this is a state that generally is talked about where people experience what they call delusions, which are fixed false beliefs. They often have a paranoid or persecutory type of thing, like someone is spying on me, someone is after me, that kind of thing. And then what they call hallucinations, which is really hearing voices, generally giving what they call a running negative commentary. So very negative content. This sounds like a real person, like they can tell you it's a male or a female voice, for example. It's kind of insulting them, telling them they're no good, this kind of experience. And it doesn't, it lasts for a long time. Now, it may not last forever, and I agree with your observation. In fact, there are a couple of naturalistic studies where they follow people over time, and after 5 to 10 years, something like 2/3 of people just go back to normal with no intervention. This research is kind of buried, though, because what they teach psychiatrists is that it's a progressive neurologic disease and it just gets worse over their lifetime, even though there's absolutely no empirical data to support that. But that's the story that they tell. And they do, of course, give these medications. But even if you look at the data, like the clinical studies, it's only about 40% of people who really have any response to the medicines in terms of decreasing those voices. And in a very small percentage, the voices go away. But I'm not sure that they really fully go away, or they just are kind of like barely audible, or the person's able to ignore them, because these drugs don't do anything specific, because no one understands really anything about the cause or what is happening there in the mainstream. They have different theories about it, but they'll admit that they don't know. A lot of this comes because they gave people a certain kind of drug and they saw something that they called improvement, and they said, well, the drug does this, so it blocks dopamine, so dopamine must have something to do with it. And that's about, the level of thinking. And so, someone might temporarily have some relief, but that's the exception to the rule. And even if that happens, the drugs cause so many side effects, like they cause you to increase your appetite and get fat, and actually eventually leads to cardiovascular disease and premature death. When these people are followed taking these medicines for a long time, they have very short lifespans. It causes permanent neurologic damage. They can have all kinds of different movement disorders. Some of them are permanent, never go away. Other ones mimic Parkinson's disease. Some of them make them restless so that they can never feel comfortable. It drives them crazy in and of itself. It can almost create its own mental disorder. And so, and there's even worse things I could say about the drugs. But what I think is most likely what's actually going on in this condition, and this, may not sound super scientific, but it's that there may actually be some kind of entity, like an external intelligence that, is inhabiting these people and interfering with their thinking and talking to them. And this is something that I first heard about from Jerry Marzinski, who is a psychologist and therapist also, who worked in the forensic mental health system with, the criminally insane, who were many people with schizophrenia who did something illegal and got, locked up for essentially the rest of their lives. And he talked to them, observed them, tried different things. And when I first found out about this, I was still practicing psychiatry, and I had a teenager who was very psychotic that I did give trials of 3 different medicines to, but they didn't make a difference. That he was so psychotic he was mute, like he couldn't talk at all. And Jerry came up with this something that he observed, that religious content actually made the voices retreat. Like, he observed this in his patients. So he tried using this method of having people recite Psalm 23. So I was able to get this kid somehow to recite this psalm in his head. And a week later, he was talking. And there was major improvement. Now, this doesn't tell me for sure, what was causing it, but it was the most dramatic result I had ever seen. And then Jerry continued to study this. He partnered with a woman, Sherry Swiney, who actually figured out how to resolve her own psychosis when she was in her 20s. And they kind of partnered up and started working with people and started having real results. And he's done a lot more investigation on this. I would encourage you to look at his work, but I think there's a lot more likelihood that that's what is causing this condition than some kind of brain chemistry anomaly.
Wow.
Dr. Kaufman, are you familiar with Dr. Ian McGilchrist's work, The Master and His Emissary? Talks a lot about the hemispheres of the brain.
No, not specifically.
You should check him out. He's really amazing. Dr. Ian McGilchrist, his name is, and he's really on the cutting edge of exactly that which you just said. And, not to get too spiritual, but I think that we've all come to this conclusion that there's something beyond just the mundane and the world that's happening here. And there's some sort of intersection between possibly the sacred and the mundane. And we're not quite sure how to deal with it. And I feel I resonate very much with that. Maybe there's something within the geometric field theory or something. We're not just in our mind. We're not just in our body. We're connected to the field.
One of the things that I've been critical with, and this, of course, it affects science and it affects medicine, but it affects also every other aspect of our life. But there was like a major change in the underlying cultural philosophy that we experience in the modern world, where it became, one of materialism, right? That's why we have atheism as the predominant religion in our culture, and scientism. So this, negates anything other than the physical material world. But yet we don't even have to look, into the spiritual realm. Like, of course, we know it intuitively from the spiritual realm, but we can even look into the mainstream science and see that there are unconscious influences, right, non-physical influences on the world. Like if we look, for example, at the double slit experiment, where we have the observer effect, right? And there are many other examples of this. There are for example, experiments where they have people try and influence a random number generator on a computer, and they can make a statistical difference in the outcome of a computer just by using their mind. So, but of course, this is, even though some of this research comes out of universities like Princeton and University of Virginia and such, it's marginalized and not widely known about, so that this materialist sort of fundamentalist paradigm in science, medicine, and even really in religion has become dominant and is not really being looked at realistically.
Mm-hmm. It's unfortunate. As a patient, my whole life has been a lot of sacred experience. When you're facing your own mortality, you're on dialysis. I mean, I had nothing to do than to really explore my spiritual side and the sacred and see all the symbology coming in. But when I tried to offer that back to the system, it's just, they don't know what to do with it. Just don't know how to function. So.
And, actually, now this is another aspect of the transplant realm that I may have mentioned from time to time, but it's really fascinating and related to that. But I'm sure you know that many times when people receive transplanted organs, they actually develop some personality traits from the donor.
This has happened to me.
It has. So will you tell us? Is it too personal?
Sure. No, it's not too personal.
You didn't fall in love with some man who was the object of affection of the donor or something, though? Because that has happened. No, but I'll tell you
a funny story about, I was involved with a swap, and the other woman who received a kidney transplant. This is a great story. Several months into her post-transplant process, she lived in Philly. She was just like a hardcore Philly type of girl. And she wanted to start going to the local bar to have a Colt 45. So like every Friday, she had this massive desire to go to the local bar and have a Colt 45. And she ended up randomly finding out that her donor was a young African-American that was shot And his favorite thing to do was to go to the bar and have Colt 45. So there are
And
things.
she got a kidney, right?
You got a kidney, right?
So now the materialist interpretation with that would be that the kidney must determine your preference for beverages.
Right. Makes total sense, right? Yeah. And then me personally, I had 2 kidney transplants because I started young. I got sick very, very young with autoimmune disease, and I was treated with all sorts of medication I would have done differently, and that's what led to my organ failure, I'm pretty sure. But the first transplant I had food, a weird food craving that was unusual. Turned out that my donor was his favorite food. And then the second transplant I had, both were living.
Was it
donors.
haggis?
No, it was probably more unhealthy. It was Utz potato chips. I couldn't get enough of eating Utz potato chips, and I'm not a potato chip type of girly, so that was
hilarious.
But the second transplant I had, I've known both of my donors, so I haven't had any deceased donors. But the second transplant I had, believe it or not, it was somebody I knew very, very well. And I could tell at a certain degree into my post-transplant process when I was more healed. And I'm also very, very self-aware. And I do a lot of psychological work upon myself, that I was starting to exhibit some of this particular relative's emotional shortcomings. And at some point, it came to me very clearly, I'm not just adopting some weird craving. I'm actually somehow taking on a part of the DNA, and I'm processing part of her traumatic experience that I know that she dealt with. It was very clear that it was coming through me. So I can't imagine people who don't understand this. They probably think they're going crazy. It probably does contribute to a lot of depression and anxiety post-transplant, with the majority of patients have those conditions post-transplant.
Well, did they teach you about this ahead of time?
No,
Probably not.
What they do is
here's what I noticed. You let a little materialism slip out in your explanation there when you said DNA.
Right. I did. Well,
there's no DNA that makes you like Colt 45.
Okay, so right.
What gene would that be? The malt liquor gene?
Yeah, right. What is it? What is it that actually a person is taking on by receiving another person's organ? What is it?
I would say the best I could answer is that it's a little part of their soul.
Yeah, I think you're right. I think you're absolutely right. And I made peace within myself when I was doing this emotional processing for this family member who was involved in a very severe car accident when she was young. And it became very clear to me what was coming through me. And I looked up to God and I said, if you think I can handle taking this on to process it, then if I can make her life somehow different by taking this on, maybe that sounds grandiose, but that's how I dealt with it. And I was able to overcome it. And her life has gotten better. Our relationship has gotten a lot better, but they make a joke out of it. They think it's funny. They'll say, do you have any silly food cravings? Let's talk about it. But I think it's actually much deeper and much more profound than just craving potato chips. So
it's a little eerie in a sense, right? And maybe the humor is just a defense mechanism to protect against that, but it sounds like you've processed it in quite a mature way, so kudos to you.
Thank you. It's been a lot of work, and going through that process allotted me a lot of time to do self-work. And this is something within the medical community, when we talk about an alternative medical community versus a traditional Newtonian Western medical model, is the folks I did connect with in those institutions who were very high level. And I was working with doctors from China at Johns Hopkins, doing peer mentorship work. And what I realized was, wow, these guys need a real paradigm wake-up call. But I thought, how would they even have the time to do the processing? I mean, I thought I've had so much time to process and integrate my entire life. How would a doctor who's so incredibly busy, overworked, stressed, has no time, actually go through this sort of awakening and integration process? I don't know.
Yeah, you'd have to step away from it.
I have another, kind of diagnostic question here around this trend of diagnosing everyone with ADHD or neurodivergence and the autism spectrum. And I'm curious how you're making sense of that. Is there something, causing these symptoms? Is it, what is the advantage for so many people to get on these medications or disadvantage? What are your thoughts on that?
Well, I think, I don't think ADHD is not actually a real thing. There was one child one time that I thought was actually hyperactive. And, pretty much within 30 seconds of him entering my office, and it was, a doctor's visit, but in a doctor's office, he was crawling on the floor under my desk and, looking around and such like that. But I think that was a neurologic, issue, or like a seizure, is a neurologic issue. That was one out of, hundreds of kids who I saw, and adults too, who were given this diagnosis and who were taking meds. And, typically the situation was that they're some kind of behavior problem in school, or they're not achieving the level of academic success that their parents expect. And then one of those two conditions leads to taking them to the doctor, and then the doctor doesn't do any evaluation whatsoever, just writes a prescription. And then they're taking, prescription, and I think the teachers like it because it makes the kids more compliant. Like the improved performance that you get from amphetamines or stimulants in research studies is like equivalent to that they can lick more envelopes, It's not that they become more creative or they're better at solving problems. It's that they can do like rote, repetitive tasks with more sustained focus. And, it's been used for fighter pilots, right? So they could stay alert and look where they're going and not fall asleep and crash. But it doesn't make them, amazing at navigation or combat strategies or things like that. And it's a big industry, so it controls people. It makes them dependent on it, because if they stop, they get withdrawal symptoms. So it's a really good business model. You have to keep selling more and more to the same customer. It makes the teachers happy, and all of that kind of stuff. So it keeps going. It's a big industry, but it's essentially no different than giving the kids crystal meth or cocaine. I mean, those drugs they're the same drug with a different name, and you buy it from a store instead of a guy in the back alley or in a trailer. So it's something that is really, really unfortunate. That has been going on and really taken hold in our culture. And I even saw, other doctors who, it was maybe hard for them to read a textbook, and they thought that meant they had a problem and should take these drugs. And it's ridiculous. Like you passed medical school, like your intellectual performance is above average. It's not, you don't have a problem there. Like everyone struggles sitting there reading a textbook. That doesn't, like all these kids I saw, they would say, oh yeah, I can't study math. And then I said, well, what about video games? Oh yeah, I played for 4 hours straight and I, got the high score. Well, that tells me that there's no problem with their attention.
Interesting.
Andy, what do you think's going on culturally with people being addicted to hyper diagnosis and these labels and meeting online, talking about this? What's going on in the minds of these children who are using this diagnosis as a way maybe to get attention or community or?
Yeah, I think all of those things are possible. Like, there's sometimes interesting cultures that develop around this. Like, I was involved doing a lot of research in public health around the AIDS era. And there was this phenomenon in some of the gay communities in big cities where it was like they wanted to be HIV positive because they were excluded, if they weren't. And it doesn't make sense on the outside, right? You see it, and I'm not trying to judge it here. I think this is just a natural group psychology behavior that people want to fit in. I mean, there's other experiments where people will, give the wrong answer on a test because everyone else is giving the wrong answer and they don't want to be singled out as giving the right answer, right? So I've seen trends among teenage girls, for example, that they'll engage in like self-harm behavior. They'll tell each other about it and they'll take turns doing it and share the experience. And it's like a trend, even though it's extremely self-destructive behavior. I mean, I'm talking about like cutting on themselves, that kind of thing. Obviously with recreational drugs, we've known about this, we call it peer pressure, but it's a very similar phenomenon. So having a diagnosis and getting this prescription. by the way, like if you go around, high school, especially a private school, a college campus, around exam times, like there's a black market value for those medications. People will take them, they think they'll do better on their final exam, or they'll be able to stay up all night cramming if they use those drugs. So there's all kinds of different angles that might, make it popular for a young person to wear that badge.
Yeah.
I'm finding this to be a fascinating conversation. And Dr. Kaufman, I first ran into you and your work online during the beginnings of the lockdown. I felt very fortunate to run into you. And speaking of the spiritual and aspects, a lot of us are feeling very exonerated about our suspicions that there was a psychological dimension to the whole COVID thing, which then where does that come from, and how does that relate to the medical, field with the psychosomatic illnesses? And you've alluded to that a little bit in your speaking about diagnosed mental illnesses, so-called. And so I was wondering if you wanted to elaborate or talk a little bit about what you feel the role of the mind and or the spirit is in health, and what we can do to kind of optimize our approach to health on that basis.
Well, this is an excellent question, and it really highlights what I was saying before about this materialist paradigm, because it wants to take the spiritual and the mental experience out of the equation and say everything is driven by the physical. And obviously that is a major shortcoming, and one of the reasons why allopathic medicine is not successful, because the mind and the spirit play a huge role, and they're, the three parts, right, they are inextricably linked, and there's multi-directional influences. So, I often kind of describe it this way, that, an insult to the body can result in a purely psychological suffering, and a psychological insult that doesn't affect the body can even result in a purely physical manifestation. And every other combination is also possible, and usually it's a combination of factors. And even if we want to approach a purely physical problem, like let's say there's a physical trauma, we get a laceration, well, there's still a mental component to the healing, because you have to decide, okay, am I gonna stay off this leg, or am I gonna go play basketball? Am I gonna eat junk food, or am I going to fast to optimize the wound healing, right? All these kinds of things come up that involve your psychological aspects, like addictions, and your level of motivation, and ability to control your behavior and such. So it's critical to look at all of these aspects in every single case. I've had a number of consultation experiences where the person who requested it described the issue as being a physical issue, and then within just a few minutes of them telling about what's going on, you could tell that they were totally hiding a psychological aspect of this. And I kind of call those a surprise psych consult, because there's a strong cultural motivation to contain these things, especially for men, right, to contain our emotions and behave a certain way. And even though in the mainstream health system they acknowledge this to some degree, they just say it's all physical. So, for example, they've done a lot of research about people with heart disease and strokes, that they have a much increased likelihood of being depressed. And I mean, you can imagine anyone who's facing a life-threatening illness, obviously they're not going to be happy about it. But they say, well, there's some physical thing from the vascular disease that affects the brain, rather than saying it's a psychological response to mortality. And so they don't really address it that way. There might be a therapist, right, like present company, who might address it that way, but the cardiologist wouldn't encourage that, unless they were difficult to deal with. Then they'd say, go see a mental health person, but not for their own well-being, more so that they can be easier to deal with and be managed by someone. So, it's of great importance and paramount to consider.
So I have a question too, talking about sort of these alternative methods that we're bringing up, and we also interviewed a Qigong teacher who, shared how he was actually finding out that people are healing through the use of exercise, what we call like the psychosomatic approach, and it's just fascinating to him, and he felt that effect, and we would ask him, it's like, well, can you describe Qi? Can you describe what is it that's healing? It's like, well, you can kind of feel it. It's like a taste of a certain fruit. It's not something you can really describe to someone particularly. But are there any problems or misconceptions common perhaps in the alternative health field, right? Because I know you have a lot of critics out there in the mainstream. And I like to think that maybe, they have some things right, they have some things wrong. Are there things maybe in the alternative media that you feel like aren't getting enough attention among people who are promoting, questioning the status quo? To what extent, right? Maybe we push it too far. We're not sometimes taking enough credit, giving enough credit where it is due. What do you think? Is there any wrong assumptions that are made?
Well, this may not be exactly what you're getting at, but I think it's important enough to bring up from my point of view, which is that there are many practitioners, some of them even that still hold a regular license, but practice what they call functional medicine, or people that might have been trained as a naturopath or left medicine and do something totally different. But the model essentially is that they, when you come into their practice, they do some kind of tests, like usually blood tests on you, but it could be some other kind of testing technology. Then that gives you some kind of diagnosis in whatever their formulation is. And then they sell you supplements based on that, which comes also out of their office. So they basically make money on you 3 times. But the supplements are, allegedly natural things and not pharmaceuticals. So I would say that that's the exact mainstream medical model, just rebranded as natural, because it's the same business model. And these, supplements, so this is the biggest misconception, to more directly answer your question, is that the idea that a substance will solve your health problems, that is the fundamental error. And I'm not saying that to never, interact with any substances, but what I'm saying is a couple things. So one is that most supplements that are recommended are essentially the same as pharmaceuticals, because they're made in a chemical factory. Your body recognizes them as foreign, not natural. They're, isolated individual chemicals. They're not something from nature. So your body can't recognize it. It doesn't have microzymas in it. We can, talk about what that is if you want later. But so there's that aspect to it. And then there's also the belief that a substance, whether it be an herb, a homeopathic remedy, a tincture, a spagyric, any of these things, and some of them are very useful, but those things don't actually do anything. They do not take action. They're not living beings. They can't do things. They can't heal things, right? Same thing is true with pharmaceuticals. It's only our bodies and our minds and our spirits that can take any action. And when we use a substance and enter it into our body, it might stimulate a reaction from our body, but it doesn't take any action itself. It's not capable of doing work. And then the question is, if you look at what the pharmaceuticals do, and some herbs and supplements also do this, do they support and aid the body's healing process? Or do they actually interfere with and shut down the body's healing process? All the things that they prescribe, or over-the-counter things that, make your symptoms go away, they're all essentially shutting down your healing, because those symptoms are your body healing, rather than supporting what the body's doing so that it can do it more efficiently and resolve it on its own. So the response, to those drugs is for the body to shut down, rather than for the body to keep going.
Okay. Yeah, thank you for sharing that. And also, to touch on, there's a lot of people who talk about diet then, right? They'll say, okay, well, then it's not the supplements, it's diet. So if you don't mind, I would like to hear your thoughts in regards to, let's say, RFK Jr. and the MAHA movement, this huge focus on maybe shifting the diet. Now, you do have a common motto on your pages. It says, be your own health authority. So what are your thoughts when, let's say, the government comes in with a certain food pyramid and says, this is the model for how people should eat? Is it a step in the right direction? Is it people starting to pay more attention? What do you think is going on?
Well, no, I mean, I'm serious about be your own health authority. It's like you have to figure out what's good to eat. And, it would be nice if the government was honest about that, or if they really knew. But that's unfortunately not the case. They're essentially representing industry interests, and maybe RFK was able to get some things slightly improved, but there's still it's not really full of truth. So, and this is also a question that's very, very difficult to answer, because there's a lot of pseudo-scientific misinformation out there. Like, for example, the Blue Zones is one of those, which was like a best-selling book that picks, several geographic locations and cultures around the world that allegedly, have a higher life expectancy and allegedly eat primarily vegetarian or vegan diets. And, there's that. It's basically every, way that you could bias information is put into that treatise, and it's, completely, you can completely throw it out. And there are many other things like that. Like, for example, there's big epidemiologic survey studies where they just ask people like what they've been eating. Like when I work with people, I always ask, tell me everything you ate yesterday. And people have a very hard time remembering what they ate yesterday. So how are you going to remember what you ate over the last 5 years? And some of these studies, like I think it's called the China study, for example, which, had some relationship between meat and colon cancer, allegedly reported. One of the things they count as meat is pizza. Now, pizza is clearly not meat, right? Pizza has GMO wheat, it has seed oils, it probably has sugar, right? It has pasteurized, highly processed cheese or cheese-related product. And then maybe it might have pepperoni, right, which has a lot more in it than just meat, right? Maybe not the real pepperoni that you get in Italy, but the pepperoni they're putting on Papa John's pizza, or whatever somebody's eating, right? So obviously the conclusions of whatever that is, you could just throw them out the window. I, after, years of thinking about this and studying, a variety of nutritional researchers, I came to the data of looking back at hunter-gatherer societies, like sort of a little bit like Weston A. Price did, but not looking at their teeth specifically. But there's a rich anthropological record of books, and Daniel Roydas helped me find some of these, because I originally heard about a National Geographic issue from the 1970s where they went to 3 different places in the world, and people lived 120 years or longer. And they, interviewed the people, asked about, what their life is like. And then I thought, well, boy, this is like in the 20th century. I bet if there's, texts from the 19th or 18th century, they would be a lot more information, like without really any influence. Like even those people in the 70s, they didn't have any Western healthcare whatsoever, for example, yet they lived that long. I think that's part of the reason, actually. But I was able to find a number of texts for a variety of groups in the Americas before they had any colonial influence. And they had amazing health. Like they essentially didn't know disease whatsoever, like no cancer, no metabolic disease, no autoimmune disease, no childhood cancer, no birth malformations, no birth mortality. Like they said the only time kids died was from like drowning or a snake bite. And people, they had no nursing homes, no infirmity, Like people were active and lived until they were at the end of their life and then they died. We don't know exactly how long they lived because they didn't keep records like we do, but they had healthy experiences their whole life. And if you look at what they ate, they obviously didn't eat any processed foods because they had no technology other than, drying or grinding things themselves. And they did actually, many of these people did eat maize. It probably looks a bit different than what we have as corn now, but they were still super healthy. So they ate, only natural whole foods with minimal, if any, processing. They definitely prioritized meat in their diet, and they only ate what was local. Like the only thing they did to eat food that wasn't in their immediate area is that they all practiced treks of various distances, where usually during a certain part of the year, some or all of the members would, go on a long journey on foot to find, a place where they had different resources, and different food resources was definitely part of that, right? Because they couldn't fly in food from South America or anything like that. And so I think, absolutely food has a huge impact on health. And, I've been talking about it just on, what you should eat to maintain your health, but there's also, different strategies that you can use to go from being, unhealthy to healthy with a temporary type of diet, which I would call a cleansing or an elimination diet, and there are different options for that. But it's really, what's healthy is real whole food grown in a natural way, animals raised on their natural food source, plants grown in, nutrient-rich soils from biodynamic farming, not with, modern NPK fertilizer and Roundup ready crops.
Wow. Thank you so much. And yeah, we hit the hour mark. I just want to say, that we have a question that we like to ask a lot of our guests.
And I have an extra question too.
Okay. So
I have one too, quick as well. I'll be quick.
Oh boy.
Go ahead, Leslie.
Okay.
Go ahead.
Sorry. My question is, you mentioned earlier about after leaving the mainstream medical practice that you're living a more moral life, basically, that your practice is more moral. And I wanted you to maybe identify the primary moral dilemmas that medical practitioners have by staying in the system, and then what would be the hallmarks of a moral medical practice from your point of view?
Well, gosh, there's so many places I go with this, and psychiatry is a special example because they actually are given the power to lock people up and take away their freedom through civil commitment. And that's something I've actually been very critical of and written about, and I got in a lot of trouble for releasing people from being confined. But across the board, I think really it's all about systemic and consent is the biggest way that you can harm patients. And there's issues systemically, and then also there's failures of the individual practitioner. So systemically, and this is quite interesting because this is directly opposed to what I was taught and what the legal precedents around informed consent are in our law. But what the practice is now for almost every medical facility, now one individual, doctor who has their own practice may not do this, but every hospital, every clinic that I've looked at their consent form, they have right in there in the beginning that you're signing away your ability to make any health decisions for yourself to your clinical team in that facility. And that is a major problem, right? Because you're essentially saying that you're incompetent to make your own decisions, and you're going to let them be your parents and decide for you because you're relegated yourself to being a minor. And that's how they can, come in when you're not looking and inject you with something that you didn't consent to because you consented to whatever they want. So that is one of the areas that people get the most serious harm from. And one of the things I teach is how to read these, they're really contracts, and that you have the right to change it, the contract. You don't have to, just agree to it because they wrote it down. And you need to do that to protect yourself. And the other thing is that the practitioner has the duty and the obligation to make you aware of the risks and benefits of each and every proposed treatment, of the alternative treatments, and of no treatment at all. And they universally neglect to do that. And they do that partly because in many cases they're actually ignorant about what the risks are themselves or what the alternatives are. And that is probably because they may have been told incorrect information, taught incorrect information, or they may have just neglected to actually look at what the data shows. They may be afraid to because that's their only option about what to do. And they never really talk about alternatives unless the patient demands it, because that means going to someone else or someone else making money or doing the job. And they never talk about doing no treatment because that's not even part of their thinking. You know, another big error that they make, and this is really a human error, but it should be something that we know is a human error and we look for all the time so that we don't make it. But it's that doctors almost never, when they're considering the explanation of what's going on with their patient, they almost never consider that something they did actually caused the problem. And very, very often it does. Like Stephanie, I think you mentioned earlier about that it was probably the medications they gave you for some quote-unquote autoimmune condition that actually caused your kidney failure. And in fact, I think the evidence supports that most of the kidney failure is from blood pressure medication, actually. It's caused by them, whereas the medical doctors say that it will actually save your kidneys when it's the actual opposite. I think the same thing, there's even more evidence to support for proton pump inhibitors causing esophageal cancer rather than preventing it. There's also evidence that sunscreens cause the melanoma rather than prevent it, like we're told, right? So the doctors are ignorant of this, of course, and then they're not going to disclose it as risks, and they're going to continue to recommend harmful treatment options.
Andy, as people like you come into greater, broader perceptual knowledge, obviously there's a role in calling out the corruption. And when everything went down with COVID, as a patient who with 2 organ transplants, I'm kind of forced to be in both spaces, a little bit of the mainstream and then a lot of the alternative. I'm kind of forced to have a relationship with both. I'd love to be all natural, but because of my journey, that's a little bit difficult to do at this point.
That's right. I'm not going to prescribe your anti-rejection meds, unfortunately.
No,
I would if I could.
Yeah, I'm not going to ask you to. But my point being is that I understood a lot of the ignorance through going through these medical institutions, really prestigious ones, and I've created really intimate connections with pioneering surgeons, et cetera. And I realized very often they were exceptionally skilled, whatever their specialty may be. But in terms of any sort of psychospiritual development, emotional development, relational issues, I was like, oh my God, these people are actually a mess. And when the MAHA movement came about and, everything, we got excited for, RFK, I had hope that we were going to broaden our knowledge base and we were going to come into something that could be implemented together, or we would find a better way to do this. And I was hopeful at first, but now what I'm seeing, sadly, is that the medical model, traditional medical model, is kind of resisting and refusing to level up and to admit their deficiencies, which causes the alternative side to be forced to call out the corruption, to shake it up a little bit, to get them to see themselves a little bit. But then as we're proceeding, I'm missing out on a little more evolutionary psychological progress between this relationship, because one's not really willing to budge and the other one is stuck in this position where they have to kind of call out the corruption and almost continue the warlike mentality. And not to get biblical, but there's a verse that says we need to be wise as serpents, which I think a lot of people in our field are becoming wise around a whole bunch of different facets of medicine that we haven't before. But how do we stay gentle as doves in terms of creating a healthier model instead of just having an outlier community that's now warring with the other community? Scott and I, we've talked about this thing called the scorpion effect, which is when you're in a particular tribe and then you outgrow it and you have to leave it. It's almost like we naturally as human beings want to turn around where we just were and sting them. And get in another war of like, I was just there, I'm not there, so now we're in this war together. So just Any thoughts on somebody who has to kind of live between these worlds, who would love to see just a more conscious model in general, where everybody has to do a little more leveling up? And kind of what I'm seeing is Western medical system stuck, and then a lot of the alternative providers are kind of stuck being at war, calling out the corruptions. Any suggestions? What do you think about that?
Yeah, well, so let me say that, many times I work with clients who are kind of caught with one foot in each of these two different worlds, and it's not good for them because they're really philosophically opposed. At least what I refer to as natural healing, which is not the kind of the medical business model pretending to be natural healing. But I don't see the war. Like, I of course criticize these poisonings because it's egregious, but I don't get emotionally involved. I'm not like suing anybody or, I'm putting the information out there so that maybe people will consider taking it into their own hands and figuring it out for themselves. Even if they choose to engage in that system, they can do it a lot more wisely if they're informed. But I think people have to kind of decide how they're going to approach things, and they're so philosophically opposed. I wouldn't advise doing both. Like, you're in a unique situation, but if we had started back, when you first had health problems in your childhood, you could have stayed out of that, completely. But obviously we can't change time, but I think you're sophisticated enough to navigate it. But in general, I think you need to commit one way or the other. I also believe that this allopathic system is built on false foundations, and it needs to completely dissolve for a new way of doing it, which really, in my opinion, is about everybody, taking health sovereignty on themselves, for themselves and their family, and that, you can go and get education and help from others, but you decide which, who to trust and who has the right knowledge. And hopefully you'll have good discernment. But there are very few situations where there's like an emergency that you really need someone else's help. In fact, one of the things I teach is how to take care of most emergency situations just by having a few very basic supplies in the house. Things like water and salt, a little bit of powders of this and that, and things like that, but can handle most of the situations. And then I also teach when do the skills of the surgeon come into play. And you're right, like, surgeons is the second most narcissistic specialty, right behind psychiatrists. And, they're also up there with addiction and suicide as well. But I've seen some of the most toxic personalities as surgeons. I've seen them throw scalpels at nurses. I've seen them hurl insults, bully people, all that kind of stuff. And yes, with their hands, they have good skills. But to be honest, the skills of a surgeon are really not much different than the skills of a butcher or a carpenter. It depends on what scale, because some even of those tradespeople, like a watchmaker, they work under magnification like a microsurgeon. And obviously the risks are greater doing it on a living, human, but it's not like they used to say in medical school, it doesn't take a neurosurgeon to be a brain surgeon, right? It doesn't take a rocket scientist to be a physicist, because you don't have to be a genius to be a surgeon, right? You just have to put in the time and learn how to sew and cut and sew. It's just cutting and sewing, right? That's all it is.
Thanks, Andy.
Sure
Thank
thing.
you so much. I mean, you're sharing such amazing information, across so many of these different fields. And, like I brought your motto to the table, you have this common saying, and it's on a lot of your social medias, your website, be your own health authority. It's a very common thing that we also share in our project at Health Revealed. We actually gathered for years thousands of different books, different research on the psychology of authoritarianism. I would consider it the biggest in history, actually, on the subject. I actually also, since you mentioned before, on the topic of cults, I actually produced a whole documentary called Cult World, going over the different facets of our society and what may be considered cults, and just really asking those questions. So my final question to you, to tie in the motto and a lot of what we're talking about, is when you say be your own health authority, does the government have any authority over your own health?
Absolutely not.
Any, do they have any role, in helping you decide your own health?
I mean, think we would be a lot better off without a central government at all. I'm not opposed with a collection of ideas that we all want to, adhere to, and that essentially that's natural law anyway, right? But no, this is my tagline, be your own health authority, that means disregard any other source of authority about your health, because it's really your interest. And in fact, I've been, putting out some content lately about this whole idea of the greater good or the public good, because this is a collectivist idea, right? And almost all public health mandate measures, right? Like the, vaccine schedule, the masks, the quarantine, right? The 6-foot rule, all these things, they're all based on, that we can sacrifice the rights of, in many cases, the healthy in order to, protect the health of maybe somebody that's less fortunate, or others, right? And so that for the good of the community, right? And that's a collectivist idea. It's essentially communism or fascism or totalitarianism. That's not, in my opinion, that is not the right way. It's not the spiritual way, and it's certainly not the culture that our nation was founded on, right? Which is based on individualism, because individualism actually brings out the greater good, because it forces everyone to be accountable and rise up, and that ends up benefiting everyone. Before we had income taxes and public welfare programs, there was an extremely well-organized network of charities. And I don't mean charities that serve some, really wealthy person's political interests, right? Because that started with the robber barons, and after taxes and social welfare programs became policy. But before that, it was, neighbors helped neighbors. They, volunteered, they donated, and the idea was to lend a hand to help them up, not to make them dependent on you and subjects of you or of the government. And that's what we would have, if these collectivism ideas didn't creep in to all of the different avenues and including into healthcare.
Wow. Well, thank you very much for sharing that. And yeah, I encourage a lot of our audience to check out a lot of our work talking about this subject, because you're right, there's a lot of new ideas or ideas people don't consider when it comes to these institutions, not just medical, but also political ideas. Maybe you have heard of like voluntarism. You mentioned natural law. Yeah, so you're definitely on the cutting edge of a lot of this, and I appreciate you for just being open-minded and having that conversation. And we always welcome our audience, anybody, whether you agree or disagree, we're having this conversation, and we want to have more of that conversation. My goal is to reach people like, Jordan Peterson, some of the mainstream psychologists, and bring up these ideas of statism and voluntarism, and getting them questioning, like, what about the authority of the government? What role does it have in our health? So I really much appreciate you being here with us. Is there any final notes, conclusion statements you want to make for our audience here on Health Revealed?
Well, I just want to invite people to, come look at my resources on my website. There's a lot of free information available, and I teach, about all the things that we talked about today. And let me just thank all the panel members for, giving thought-provoking questions and commentary. It was definitely an enriching experience.
Thank you so much.
Yeah, thank you. Appreciate very much your work.
Dr. Andrew Kaufman, MD, on all platforms. Be sure to check him out. Thank everybody for watching. This is Health Revealed, healthrevealed.org. That's healthrevealed.org. Take care.